Good day everyone. The drug on review for today is Azithromycin 500 mg. Other oral forms available are the following: 250 mg capsule, 250 mg and 500 mg tablet, 200 mg 5 ml powder for suspension in 15 ml and 60 ml. Also, it is available in injectable forms. It's 500 mg powder vial. Please remember this is a prescription medicine and is taken under the strict supervision of your doctor or healthcare professional. This discussion is made for your awareness and information only. Here are the indications for azithromycin. For lung-related problems, azithromycin is used for the following: treatment of respiratory tract infection, prophylaxis, and as a component in the treatment regimen of Mycobacterium avium complex. For low-risk community-acquired pneumonia in adults when Legionella, chlamydia, or mycoplasma is suspected. For non-severe community-acquired pneumonia in a child with hypersensitivity to amoxicillin. It is used for ear-related problems such as otitis media. It is used for skin and soft tissue infections. It is used for genital-related infections such as uncomplicated genital infections and suspected uncomplicated genital chlamydial infections. Examples are urethritis, cervicitis, and trachoma. It is used for heart-related infections such as the prophylaxis of endocarditis in an at-risk patient unable to take penicillin. It is used for body-related infections such as the management of typhoid. It is used for eye-related infections such as the management of trachoma. It is used as an alternative antibiotic treatment for patients that are hypersensitive to beta-lactam antibiotic therapy, and also for non-severe community-acquired pneumonia in children with hypersensitivity to amoxicillin. Recommended intake amount of azithromycin are the following. The adult oral intake is 500 mg as a single daily dose for 3 days, or initially 500 mg followed by 250 mg daily for a further 4 days. For genital-related problems, such as chancroid and uncomplicated genital infections caused by Chlamydia trachomatis, take 1 gram as a single dose. For uncomplicated gonorrhea, take 2 grams as a single dose. For granuloma and Guinea, take initially 1 gram followed by 500 mg daily, or alternatively, take 1 gram once weekly for at least 3 weeks. For body-related infections such as the following. For uncomplicated typhoid fever, a child's oral doses, give 20 mg per kilogram body weight for 5 to 7 days. And, for the adult oral dose, take 500 mg to 1 gram for 5 to 7 days. For complicated typhoid fever, a child's oral doses, give 20 mg per kilogram for 5 to 7 days. And, for the adult oral doses, take 500 mg 1 to 2 tablets for 5 to 7 days. For mild leptospirosis, a child oral dose, give 1 gram loading dose then 10 mg per kilogram for 2 days. For moderate to severe leptospirosis, a child oral dose, give 500 mg for 5 days. For the prophylaxis of leptospirosis, the child's oral doses, give 10 mg per kilogram if children are exposed for more than 7 days. The dose should be repeated after 1 week. For acute bacterial arthritis, monoarticular, the adult oral doses, take 1 gram for 7 days. This is the minimum intake amount for this. For the dental prophylaxis of a patient with an allergy to penicillin or ampicillin antibiotics, the child's oral dose is 15 mg per kilogram of body weight, and the adult oral dose is taken 500 mg. For eye-related infections such as conjunctivitis caused by Chlamydia trachomatis, the neonate oral dose is taken for 3 to 10 days on a dose of 20 mg per kilogram body weight every 24 hours for 3 days. For gonococcal conjunctivitis with a presumptive chlamydia co-infection, for adult oral dose, take 1 gram per day plus topical levofloxacin or tobramycin or erythromycin ointment every 4 days for 2 to 3 weeks or until resolution of symptoms. For lung or respiratory tract-related infection, the prophylaxis of disseminated MSC infections, take 1.2 grams once weekly. For the treatment or secondary prophylaxis of other antimycobacterial infections, take 500 mg once daily. For the treatment of pharyngitis or tonsillitis with a penicillin allergy, for the child oral dose, give 12 mg per kilogram for 5 days. For the adult oral dose, take 500 mg then 250 mg for 4 days or take 500 mg for 3 days. For the management of pertussis, regarding the infant oral dose, please take note of the following carefully. For infant lesser than 1 month, give 10 mg per kilogram every 24 hours for 5 days. For infant greater than 2 months, give 10 mg per kilogram on day 1. Then, 5 mg per kilogram every 24 hours for 4 days. For adult oral dose, take 500 mg on day 1, then 250 mg every 24 hours on days 2 to 5. For acute bacterial exacerbation of chronic bronchitis, which is severe, for adult oral dose, take 500 mg every 24 hours for 3 days. For community-acquired pneumonia, for child oral dose, give 10 mg per kilogram for 3 days, or give 10 mg per kilogram on day 1 then 5 mg per kilogram on day 2 to 5. For community-acquired pneumonia with low risk, without comorbid illness. Adult oral doses. Take 500 mg for 3 to 5 days. For low risk, with stable comorbid illness. The adult oral doses. Take 500 mg with coamoxiclav or cefuroxime for 3 to 5 days. For moderate risk, the adult oral doses. Take 500 mg with ampicillin sulbactam or cefuroxime. For high risk for P. aeruginosa by IV infusion. The adult oral doses. Take 500 mg with piperacillin tazobactam, cefepime, meropenem and gentamicin, amikacin. To be taken with or without food. May be taken with meals to reduce GI discomfort. Swallow the tablet whole. The capsules should be taken at least 1 hour before or 2 hours after food. The oral suspension should be shaken before use. It is stored in the refrigerator for 10 days and can be taken with food to reduce GI discomfort and increase tolerability. Do not take azithromycin when you have the following conditions. For instance, if you have a history of cholestatic jaundice or hepatic impairment associated with prior azithromycin use. If you have a severe kidney problem or renal impairment, you need to see a specialist. If you have a severe liver problem or hepatic impairment, please see a specialist for the management and the reduction in the dosage. Precautions when using azithromycin if you have the following conditions. If you have a cardiac or cardiac-related conditions. If you have a renal impairment and myasthenia gravis exacerbations. If you are an elderly patient. If you are breastfeeding. There is limited information available for this medication for breastfeeding patients. Use only if adequate alternatives are not available. Common side effects are the following: abdominal pain, arthralgia, cramping, diarrhea, dizziness, dyspepsia, flatulence, headache, malaise, nausea, pruritic, rash, vaginitis, and vomiting. Follow these tips on storing azithromycin. Store it in a cool, dry place and not in direct sunlight. Store it at temperatures not exceeding 30 degrees centigrade. And remember to keep this product away from children. Other recommendations when taking azithromycin. If you are taking other medicine, please let your doctor or healthcare professional be aware of it. If you are taking antacids such as aluminum or magnesium hydroxide-based antacids, antacid reduces the absorption of azithromycin. If you are taking oral contraceptives, the therapeutic effect may be reduced. Do not take azithromycin together with the following medicines, such as digoxin. This may have an increased serum concentration, such as an emergency medicine like amiodarone. This may increase the risk of toxic or adverse effects. And also an antimalarial drug such as the combination of artemether and lumefantrine. This may increase the risk of toxic or adverse effects. Also, here are the health and safety tips that you may want to remember again. Do not self-prescribe. Please remember that this is a prescription medicine. Let your doctor know or your healthcare provider if you have a liver, kidney, or heart problem before undergoing this treatment. Complete the full course of this medication. Thank you for the time and listening to this video. Have a great day ahead of you.